Hey, future pharmacists. If you're just starting your bee farm journey, you've come to the perfect spot. In this explainer, we are diving deep into the world of liquid medicines. You know, the syrups and solutions that are really the bedrock of your entire pharmacy career. So picture this. You're in a lab and you've got a brand new drug molecule. The very first question you have to ask is, okay, do we make this into a solid pill or a liquid potion? It's a huge decision, and today we're going to break down all the science and the strategy that goes into making that choice.
So, here's what we're going to cover. We'll kick things off with the why. Then we'll get into the two main types you'll see all the time. After that, we'll weigh the good against the bad, uncover the secret ingredients that make it all work, and wrap up with the real art of dissolving things. Okay, let's get right into it. Why do we even bother with liquid medicines when, pills seem so easy? Well, it's all about understanding their fundamental role in getting drugs into the body effectively. At its heart, it's actually pretty simple. A liquid dosage form is just a drug that's been mixed into a fluid. It's either completely dissolved, kind of like sugar in your coffee, or it's suspended as tiny little particles floating around in there. But of course, it's not that simple. Not all liquids are created equal, right? In pharmacy, you're constantly going to run into two main categories, monophasic and biphasic systems. Knowing the difference is absolutely key, so let's break them down. On one side, you've got monophasic systems. Mono means one, right? So it's just one single, perfectly mixed liquid, a true clear solution. But on the other side, you've got biphasic systems. Bi means two. And here you've got two parts that just don't want to mix. The best way to think about it is a salad dressing. You know, oil and vinegar? You have to shake it up right before you use it. In pharmacy, those are your emulsions and suspensions. Now, within those single-phase, monophasic liquids, you're going to see a ton of these for internal use. Things like cough syrups, elixirs, simple solutions, drops. These are all super common forms you'll be dispensing for your entire career. And it's not just stuff you swallow. That same single-phase principle applies to products you use on the outside, too. From mouthwashes and gargles to eye drops, ear drops, and nasal drops, it just shows you how versatile a simple solution can be. All right, so this is where it gets really interesting. When do you actually choose a liquid, and what are the catches? This is where your critical thinking as a pharmacist really comes into play. You're always weighing the benefits against the challenges. The biggest pro for liquids? Speed. A drug that's already dissolved just gets to work way faster in the body. Plus, some drugs, like castor oil, can only really be given as a liquid. But the downsides are pretty significant. It's so much easier for a patient to mess up a dose with a spoon than it is with a single pill. And for us, the formulators, liquids are just less stable. They can grow microbes if you're not careful, and they're usually bulkier and more expensive to make and ship. So if liquids have all these problems with stability and germs, how do we fix them? Well, that brings us to the secret ingredients, the supporting cast that makes the whole thing work. These are the excipients, the true unsung heroes of drug formulation. Just think of it like this. The drug itself is the star of the show, but the excipients, they're the entire production crew. They aren't the active part, but without them, the medicine might taste awful, go bad on the shelf, or just flat out not work. Let's break this down. Sweeteners like sucrose, that's a no-brainer, right? They make the medicine taste better, which is super important, especially for kids. But the others are all about the science. Buffers, like citrates, keep the pH stable, because the wrong pH can literally make a drug fall apart in the bottle. Antioxidants stop it from going bad when exposed to air. And preservatives? Oh, those are non-negotiable. They stop nasty microbes from growing in there and making someone even sicker. And this brings us to our final, and maybe the most scientific piece of the puzzle. How do you get the drug to dissolve in the first place? I mean, you can have the perfect drug and all the right excipients, but if you can't get it into the liquid, none of it matters. This is the art of solubility. So first things first, let's get our terms straight. Solubility is really just a measure of how much of your stuff, that's the solute, can completely disappear into your liquid, that's the solvent, to make it perfectly clear solution. This is the million-dollar question in pharmacy today. A lot of new, really powerful drugs are, unfortunately, not very friendly with water. They just don't want to dissolve. So what do? The answer? You pull out your pharmacist's toolkit of clever tricks. We call them solubilization techniques. These are the methods you're going to learn to tackle that challenge of a poorly soluble drug. Pharmacists have this whole bag of tricks to boost solubility. Here are 5 of the most important ones you need to know. Think of them as different strategies you can use, depending on what the drug needs. Let's do a quick flyby of each one.
First up, pH adjustment. A lot of drugs are what we call weak acids or weak bases, and that just means their solubility can change a lot, depending on how acidic or alkaline the solution is. So sometimes all you need to do is add a buffer to tweak the pH, and boom, the drug dissolves way better.
Next is co-solvency. I like to call this the buddy system. If your drug hates water, you just add a little bit of a co-solvent, something like ethanol that's friends with both the water and the drug. It basically acts as a bridge to help pull the drug into the solution.
Complexation is a really cool bit of chemistry. Here, you add another molecule that actually links up with your drug. Together, they form a new, bigger structure, a complex, that actually is soluble in water. It's like giving your drug a soluble partner to carry it into the liquid.
And finally, there's a more physical approach called micronization. This is where you just grind the drug particles down until they're incredibly tiny. By making them smaller, you massively increase their total surface area. That gives the liquid way more places to attack and dissolve the particle, which makes the whole process happen much faster.
And that brings us to the end. And a big question for you, the next generation of pharmacists. As we discover more and more complex drugs, a huge number of them have really poor solubility. So think about this. Which of these techniques do you think will be the most critical tool for the pharmacists of tomorrow? The answer is going to shape the future of medicine.